How are you?
Yeah, Jason came out with me to Western North Dakota when I was a freshman member of Congress. We hosted a bunch of members of Congress out, took them through the Bakken. Been a really good friend of mine for a long time, so say hi to him.
You have a lot of friends in Congress, given the time you spent there in the House, so I imagine that kind of helps with the Rolodex, and whenever you're looking to, as governor now, move the needle a little faster in North Dakota. Is that fair to say?
Yeah, I think, it was always so easy to do this job when you have like Governor Hoeven, who becomes senator, Public Service Commissioner Kramer, who becomes senator, Public Service Commissioner Fedorchuk, who becomes congressman. But the one thing I think we have a unique ability of is I spent 6 years in D.C. So like when I call Senator Kramer or Senator Hoeven or Congresswoman Fedorchuk, I know what their day-to-day life is like. So being able
what to ask and what not to ask, because you know what they can't get done.
Yeah, or also when, right? Like I know that if we have a natural resources issue, that Julie's not on natural resources, so I would prefer to give her as much time as possible to work those traps as you're dealing with some of that stuff. And it's where we've noticed it the most, I think, because it's not just me, right? Roz was with me in D.C. Aaron Weber was with Senator Hoeven. Connor Swanson was with me in D.C., and they're all North Dakota kids. You got Wishick, Bowman. Roz is from Minneapolis, but she went to NDSU and hasn't left since. So the rural health transformation and dealing with HHS, the legislature, but also dealing with, Dr. Oz's team and Kennedy's team and making sure that we understand what they want so we can deploy it as quickly as possible here.
One of the things I want to ask Chairman Smith later is related to Medicare and Medicaid fraud, and obviously many tentacles of that touch the state. We hear a lot about Minnesota. We've heard about California. And my question to him is just how much fraud do you think is there, and what does that mean for our ability to channel those funds either to debt reduction or, spending priorities or whatnot? What, as far as North Dakota's concerned, what do you?
Well, I think there's two different sides to it. Whenever you have that amount of money that is moving around, I mean, this is 10 years as a criminal defense attorney, you're going to have these cases. It exists. There are always people looking to take advantage of the system and to find a shortcut. I don't think we are in the same scenario where you have this communal overall like organized fraud capacity, but this is a perfect example of, I think, the right way for North Dakotans to do things. Attorney General Wrigley and Pat Traynor at HHS have been talking about this and coordinating and cooperating, and then working with J.D. Vance's team and other AGs across the country. They're not holding press conferences about it. They're not like politicizing it. They just are cooperating with two different agencies trying to make sure that we hold everybody accountable for it, because it exists everywhere. I mean, like I said, if there's that much federal money that's available, you have to figure it out. And I think Drew and Pat have created a really good relationship to figure out where it's at, because we want to get it too, right? Like we don't want it for the headline. These are taxpayer dollars.
Governor Kelly Armstrong with us till the bottom of the hour. If you have a question or comment, always welcome those at 701-271-1100 on the program today. And Addison, you just tell me in my ear, I'm watching the text line here as well. You can text or call that number at 701-271-1100. You mentioned Pat Traynor. Are you like, do you have him in handcuffs so he doesn't leave that job?
No, I mean, when we brought Pat on, I just couldn't think of somebody better to come in at that scenario and do it. But he was always time limited. He was very clear with that. He's going to want to see this through. So the rural health transformation, it's the biggest agency in North Dakota, and there are always issues with that. And at the same time, you're trying to figure out how you responsibly deploy federal money into an ecosystem, not just to prop up failing systems or not just to pay for things the way we used to pay for things, but how do we actually do this that is self-sustainable when the federal money goes away? Because I'm very serious about that. I don't want to use federal dollars for something that we are going to have to pay for when those federal dollars go away.
Because then you're just addicted to them. It's like much of the world on COVID money. All of a sudden it was a spend that was going to be there forever, right?
Yeah, and when it's gone, then the state has to take it over, and I'm not interested in growing that side of it. But there's a lot of one-time money and equipment purchases and things you can do that really can help rural healthcare in North Dakota, but it also isn't 5 new FTEs that now all of a sudden you have to pay for when you're done.
If you had a blank canvas next to you right now, paint me the picture of if you got your wish on rural health transformation, what that looks like in the end, not only for the care, but also the financial side.
So two things. One, I think there's preventative care and acute care. I think the biggest crisis facing rural America as a whole, not just in North Dakota, is how we deliver emergency services. And we treat rural ambulance and things a little different than like rural fire, law enforcement, because of how the repayments go. But that is a struggle that is existing. We've actually talked to Brooke Rollins about this. We've talked to Department of Labor about this. Like, how do you deliver those emergency services in areas where that old model of volunteers who drive and do that just doesn't exist anymore? So I think that piece is something that rural communities all across this country have to work with each other and work with this administration to figure out how we deliver that. And then I think in the preventative care side, you have to utilize technology. You have to utilize mobile labs, telehealth, and be able to provide some of those services associated with whether it's CHI and Dickinson, Sanford and Fargo, all true in Grand Forks. I think there's ways where you can create synergies that allow for that to happen.
You've told me the number, and I don't remember what it is, but it made national news when you said, look, give me, I forget, I'm spitballing, 60% of what you give us now and over X amount of years, and we'll deliver better care. What's the number?
I mean, I don't know the exact number, but I would take 2/3 of the money that we get now with more flexibility. And I don't know anybody who wouldn't rather have that option into it. Now, the flip side to that is how they are doing this rural health transformation program, because there are a ton of strings to it. And I think they need to loosen that up a little bit. But the reason they exist is because they want this money accountable. They are very specific about not propping up failing systems, not doing things the same way we've done them for 30 years, even though we know they don't work.
But I want people to understand, when you talk about 2/3 of the money, the federal government, the check they
I
write,
think you could save the federal. I mean, you could lower the federal deficit and deliver better services in a place like North Dakota if you took out some. If you just said, hey, we'll give you 2/3 of the money we give you for anything. It doesn't have to be healthcare. It could be roads. It could be whatever. But spend it however you want, and then let's audit it at the back end.
That's the biggest vision, because that would transform everything, as you say. You got a year and a half left in the Trump administration if we don't win the midterms. Maybe, hopefully 3.5. But how do you, if you got that done and you got the Trump administration to agree, how do you make sure it's there?
Yeah,
beyond Trump.
I think, one, I think you got to pass legislation. The legislation is more durable, but I'll give you a perfect example. One of the things we appreciate so much about this administration is their cabinet members come here. Yeah. So Secretary Turner was in Fargo and trying to explain, when you have the state ready to go on a project, the locals ready to go on the project, but you don't have HUD ready to go on the project. And it's a perfect example, right? It's state, local, federal, public-private partnership, but it's also North Dakota. If you miss it by a month, you miss it by a year because of our construction season. So that was when he was here, he took that to heart, because I think you had nonprofits at the table, you had local government at the table, you had state government at the table, and everybody was looking at the Secretary of HUD and say, hey, you guys do a really good job. Could you speed it up?
Could you do it like we do it in North Dakota?
Yeah, could you just do it a little faster?
You mentioned AI and technology, especially as you get in preventative care. Just real quick on this. When Governor Burgum, now Secretary Burgum, was here, he talked about stage 4 cancer and how it always starts at stage 4. And he believed that with AI tools, you'd start having conversations of detecting it earlier and getting away from it always being stage 4. I saw a comment you made after that said something to the effect of, let's not make wild promises like that. What did you mean by that?
I didn't say that.
Didn't you?
No.
Okay, I thought there was something related to healthcare that you said, let's be careful not to overpromise on AI.
No, I think the skeptic, I don't remember saying that. So I don't think I did, but I do think we have to be. The technology is going to exist faster than the regulation does it. So this is a perfect example, like when you're talking healthcare, you got coding and like, it's great to have a system. The federal government has to allow you to utilize the system because so much is Medicare and Medicaid. But after the break, I can tell you.
Yeah, we'll touch on that again. And I also want to find out about what's it like to be at a World Cup game, because you've been there.
I have.
Along with your bride, our First Lady, Kirsty. So pretty cool. I got to ask about that too, because there is World Cup fever in the USA, and the Europeans love America more than the Democrats do right now. Prove me wrong. More after this. Back on What's on Your Mind, brought to you by PetroServe USA, where the home cooking is on. And I know the governor is going to bring this up, so I'll preempt it. And that is he loves the pistachio nut. I had a hard time with these because they're like Shrek green, and that kind of freaks me out. But I did try one, and now I agree with you. They're great.
So I had a Sandy's donut this morning in downtown Fargo, and it's not great for my waistline, but the pistachio donuts or the pistachio muffins at the PetroServe are phenomenal, and they are bright green, and that is perfectly fine with me.
I don't know. I got to get beyond that, but anyway, do you want to finish quickly?
Yeah,
on
I was
the
just
whole
going to say,
AI concept?
I mean, there's a lot of different concepts, but I think one of the things we have to figure out is how the boring AI works and get people's comfort level. And I use the example of like trying to figure out how you integrate it into some things, and I think, rental car companies during COVID figured some of this stuff out with preventative maintenance. When do you sell a car? When do you change the tire after it blows? Or, starting to do those, like think State Fleet in North Dakota. Do you have too many cars located in the wrong places? Things that don't involve citizen privacy, don't involve some of those things that are truly scary to people. And start figuring out how you can implement some of that to make, to make government more efficient.
Have people work smarter and do the stuff that's easy to
municipalities
offload.
are using it for traffic lights, right?
Yeah.
Like they can do traffic flow studies through AI and say why this light should be on for 90 seconds and the north-south one should be on for 45 seconds. Well, people will like that when they get home quicker.
I'm curious if you have thoughts related to the pushback on data centers. Florida, for instance, right now, Ron DeSantis, freest state in the nation besides North Dakota, is saying, well, we're going to pump the brakes on data centers. There's moratoriums popping up. We've had a big disease here of not in my backyard, build anything nowhere next to anybody. You taught me something one time when we talked about the environmental extremists. Mm-hmm. And you said, doesn't matter what you and I think, Scott. If you survey anybody 30 and under, they want it. So we got to be cognizant of that as conservatives. I feel like we're in the same position related to data centers, which really I call intelligence factories because it's just another thing that we could build here, but it scares people and we got to deal with that, right?
Yeah, and there are issues of, this isn't unique to this, but there have been some actors in this space, not necessarily in North Dakota, that have tried to bully their way into small. We've seen that happen in North Dakota, not in the data center space, right? But we've seen people come into town and going to tell us local yokels the way things are going to go. That never works well. It started with 5 companies that, quite frankly, their CapEx in the last 3 years is more than the entire history of their companies combined. You never get a second chance to make a first impression. I think they're struggling from a lot of that right now. And my advice to everybody is always be honest. Don't try and do things too fast and try and pull something over the locals. And make sure you are realistic with people about where you're at. And then the other answer is I think some of these are too big, too fast. A smaller, you're not going to build it all
especially in North Dakota, right?
Yeah, but you're not going to build it all in 1 year anyway. So build it with the ability to add
Scale
on
it, yeah.
and let people recognize that this isn't going to destroy your community and it is going to help you with your emergency services and your property tax base and all of that. But you have to be able to do those things in a way that's transparent or you're going to lose people. But there is a ton of misinformation out there, and the amount of AI-generated anti-data center social media posts is really
I'm curious what you think about this, and maybe there's examples from your IT folks or whatever. Utah, massive project planned right now. Kevin O'Leary's in the middle of it. Kevin O'Leary has a massive social media following, right? The day that data center is announced, his social media goes 10x, and they said, where is this coming from? All bots. Mm-hmm. All bots, all China, all bad actors trying to scare people in Utah across the USA. How much of that do you think leads to this disinformation?
Well, I think obviously we live in a world where we get a ton of information on these supercomputers in our pocket, and it's the same thing I tell every high school class, not just about this, but I was like, you have to seek out news for information and not affirmation. We have more information available to us at the touch of our fingertips than at any other time in history. Each and every human being who owns a phone also has a specific algorithm designated to their personal preferences And that algorithm will continue to push those same things over and over again.
Many times bad actors.
Yeah, 100%.
Really bad
I mean,
actors.
and this is going to be part of that conversation. I mean, I was part of that conversation with censorship during COVID, and I don't know if you know this about me, Scott, but I'm pretty much an anti-censorship guy in all realms. I'm
quite aware. You kind of appreciate the Constitution
yeah,
and our
and
amendments.
it's gotten me in trouble with Democrats. It's gotten me in trouble with Republicans. It's gotten me in trouble everywhere else. But I mean, I think that's one of the defining questions we're going to answer is, like, I get that it's free speech, but if it's also not an actual human, I'm not sure that's the best approach to consuming information anymore.
I'm going to go rapid fire through some questions, but first you got to give me your best 30 seconds on the World Cup game.
50,000 Scots and 20,000 Norwegians in downtown Boston in the span of 36 hours, and I've become a soccer fan. I think the U.S. needed this. I think other countries needed to see the U.S. and not just listen to their international news or their politicians about the U.S. And I'm not saying I'm going to be watching soccer every day of the week from now until whenever I'm done watching sports. But it was a really, really cool experience, made more so cool because my wife is obviously from Norway. Norway hadn't been in it in a while. The national pride, not just there, but downtown Seattle when the U.S. team played, it is really amazing.
It is on many levels. A couple questions trickling in I want to get to. Just quick answers if you could. Would Governor Kelly approve of being at the Republican Roundup in August, as we did with Governor Schaefer, Governor Hoeven? Dan Traynor organized it in Devil's Lake in the 90s.
Send us the invite and we'll see where we're at.
Another listener says, have you driven by the Harwood Data Center? The amount of people and equipment there is incredible. Why are we not promoting this? What a boom for businesses in a small town.
When Secretary of Labor was out here, we ended up going down there and looking at it. I haven't been out there recently, but it's a very large facility, and it's going to be a net value add for that community, I think.
Another listener, I absolutely agree with Governor DeSantis. We must halt these data centers. They're going overboard, building these things, seems like on every corner. Slow down. People have many concerns.
And I would argue, I have people that say North Dakota's not going fast enough. I have people that say North Dakota's going too fast, and I think we're approaching it. I'm not saying everything needs improvement, but it seems like they're going up on every corner, and them actually going up on every corner are two very different things.
Last one, can we ramp up getting some electricians and nurses?
Yeah, both on the front end and the back end. I think that's what our CTE schools. I know they just did the nursing program in Dickinson State is doing some of those things. We have to get people that want to go into those professions, which is where I think the CTE schools are great. I got to meet a couple kids from Watford City who were working for an electrician 10 miles from their hometown with their degrees. But it took us decades and decades to get into this problem, and it's going to take us longer than 5 minutes to get out. But you're exactly right, because AI and nurses or electricians and nurses aren't getting replaced by AI.
No, and we're playing the long game there, building our own, which I think is brilliant. Legislature deserves a lot of credit. It took some time, but boy, that's a quiet success. It should be a loud success.
And we started it early because the oil boom out of necessity, and Governor Burgum did a great job.
Good to see you, Kelly. Thank you. Governor Kelly Armstrong, our guest on What's on Your Mind.